The Compliance Perspectives podcast is sponsored by Case IQ, a global provider of whistleblowing case management and compliance solutions. Learn more at caseiq.com. Welcome to the Compliance Perspectives podcast. I'm Adam Turtletaub from the Society of Corporate Compliance and Ethics in Healthcare Compliance Association. Joining us today from Albany is Colleen Gianatasio. Colleen is Vice President of Compliance at Covenbridge. And today we're going to be talking about value-based care. Colleen, thanks for joining us. You're a big advocate for looking at value-based care from a people, process, and technology perspective, which makes a lot of sense. But in case there's a skeptic out there, what makes that approach work best?
Thanks, Adam. I think what we have to remember is that our healthcare infrastructures were built in a fee-for-service environment, and we've worked in that environment for about 30 years. What we're trying to accomplish in value-based care is so much more complex than fee-for-service, right? As a reminder to everyone, what we're trying to achieve in value-based care is to quadruple aim, and that consists of four things. One is improved population health outcomes. Two, improved patient outcomes. Three, improved provider satisfaction. And number four, we're trying to do all of this while reducing costs. So it's a lot, and it's not easy. And unfortunately, it can't be done with just a flip of a switch or by implementing the hottest new piece of technology. So we've got our work cut out for us, and it's going to be a long road.
I'm just excited that you mentioned technology and didn't propose that AI would be the ultimate solution for it, which it seems to be all the time these days.
Yes,
Um,
AI is not the end all be all.
Now, you laid out three different parts: people, process, and technology. Let's take them one at a time. First, let's look at people. How should value-based care be approached from a people perspective?
Okay, I'm going to break this down. There's a lot of people involved in the equation, but for our purposes today, I'm going to break it down into three: our patients, our providers, and our communities. Starting with our patients. Our patients today are different than patients of yesterday. They no longer abide by that old school patriarchal system of medicine where the provider tells you what to do and you do it, right? Now our patients are demanding what they want for their care, and they have so much more transparency into the care that they're receiving through patient portals, through pricing transparency. We never had that in the past. It's here now, and our patients want a voice in their care. I would advise that for both providers and payers, that you ensure that your patients and your members feel heard by providing that consistent open communication. And if you want to take it even a step further, create committees or meetings specifically for the reason of bringing your patients or members together so that their voices can be heard. Moving on to providers, it's no secret, right? It hasn't been a secret for years. Our providers are burning out, especially our primary care doctors. So we need to ask ourselves, what are we doing to make our providers' jobs easier? And then lastly, our communities. We need to understand them better. Social determinants of health are playing a huge role in the work that we do in VBC, and this role, I would expect it to grow over the years. So you need to be asking yourself, what's your organization doing about learning about their communities? How are we gathering, reporting, and acting on the needs of communities, whether it's related to housing, income, or transportation? And that's just to name a few.
That's both a few and also a lot when you count all the people that are involved. So what about from a process perspective?
How we deliver the care is different now than what we've done in the past. So there are all different kinds of value-based contracts out there. We have ACOs, we have shared savings, we have capitation. No matter what type of arrangement, we need to make sure it's a win-win for both provider and payer. And I've said this for years. Years ago, we'd see the provider on one side, the payer on the other side, with a fence in the middle, right? And they were sometimes working in almost like an adversarial type of way. Well, in value-based care, that can't happen. In order for value-based care to be successful, Both providers and payers need to be successful. Um, so here, as you start this deep look into your processes, I would ask 4 questions. What are the needs for both parties? What are the challenges and barriers to meeting those needs? What technology or resources are currently available? And how will providers be measured for success? And how and when will they be reimbursed? Those 4 questions should get you started in the right direction to change the processes that need to be changed to be successful in value-based care.
So, finally, from a technology perspective, what do we need to be thinking about? And you already indicated it's not just AI.
Yeah, you said that in the beginning, right? So AI, it's super exciting, and wow, the things it can do. And there's beyond AI, there's all kinds of new technology. Super exciting. It is here to stay. But in the same way, especially as we're speaking about compliance, very scary, right? We need oversight into this. So my advice here would be to be very thoughtful in the implementation of any of these solutions. When you're considering a new solution, whether it's a new piece of technology or AI, all your stakeholders need a seat and a voice at the table. So going back to our providers, right? Let's make sure that these solutions are simple and they fit into a busy clinician workflow. For example, I would ask myself, does a provider need to sign into several different systems to do their job? If so, it's not a long-term solution, right? The providers just don't have the time. We want to reduce any of that abrasion. So that would be my advice with technology. Make sure that everybody's voice is heard and that you have the right people sitting at the table as you're thinking on implementing these.
So, hand in hand with getting everyone together is making all the various pieces, the people, the process, and technology work together. What are some of the best ways for organizations to tie them all together?
Great question. It sounds a little cliche, but break down the silos. And unfortunately, silos still exist in most organizations just because this value-based care effort crosses almost every department of your organization, and silos exist. We just have to be realistic. So bring the right people together and have them meeting regularly. I would also stay up to date and keep communication open and frequent with the entire organization. Everybody from your front desk person or your call center representative all the way to your CEO needs to know what their role is in value-based care and the success of that at your organization. And then lastly, I would consider bringing in an impartial third party to give an honest assessment of your current people, process, and technology.
Colleen, thank you for sharing these insights on how to make values based care work. I want to thank all of you for taking the time to listen. I'm Adam Turteltaub from SCCE and HCCA. I hope we're able to expand your compliance perspective.